Now, hold on. 3, 2, 1. Hi, good afternoon. Welcome to the CAES seminar series. This Wednesday, we have Dr. Sara Nason from Department of Environmental Sciences. She will give a seminar entitled on drug, mental health, and disinfectant changes in sewage sludge chemical signature during COVID-19 pandemic. So I will let Dr. Joseph Pignatello to introduce Sara to you all. Thank you.
Hello, good day, everybody. I'm the department head of the Department of Environmental Sciences, in which Sara is in, and I'm pleased to introduce her today. So Sara joined us in February of 2019. After completing her PhD at the University of Wisconsin in Madison, and then doing a postdoc at Johns Hopkins University. She comes here with great experience in LC, liquid chromatography, high resolution mass spectrometry. And she's using this to look at both targeted and non-targeted organic compounds in a variety of different matrices. So she's looked at the impacts of reclaimed wastewater for crop irrigation. She's looked at the analysis of sewage sludge in regard to the COVID-19 pandemic, which she's talking about today. A lot of her work has been done on PFAS compounds, perfluorinated compounds, where she's developed and tested software and used it to look at phytoremediation and uptake by plants. And she's involved in some other projects where she's looking at the fate of organic compounds in various environments. Sara, I'm really excited to hear about this project, so go right ahead.
All right, thank you for the nice introduction, and thank you all for coming to my talk today. This has been a really interesting project to work on. We were able to get access to samples that were collected during the whole first wave of the pandemic here in New Haven, and I'm excited to share our data with you. So I thought I'd start about talking about this emerging area of research that's really come to the forefront during the pandemic, and that's our ability to measure virus RNA levels in wastewater and sewage sludge and see the correlations between the virus levels in the water and sludge and between case rates and hospitalization rates within the community that the wastewater treatment plant serves. So there's some data on this slide. This is from a study that took place here in New Haven, where on the left, you can see we have a graph that's showing our positive COVID-19 test. You can see we had a peak in the middle of last April. And then on the right, this is a graph of the measured SARS-CoV-2 virus RNA in the sewage sludge sample. So we also see that peak in mid-April. And the authors here, they were able to show correlation between the virus RNA levels and positive tests and hospitalizations. And it's really a cool emerging area of research. Studies like this have been taking place all over the world and providing really a lot of valuable information to governments and municipalities to have information about community level COVID-19 rates. That it's a different type of information than when you have to test all of the individuals. It can also be useful in contexts like, for example, a university. If you test the wastewater outfall coming from like that very specific community, you can get some early detection of COVID-19 sometimes. It's really been a useful tool. However, my area of research is not on viruses. I'm a chemist and I study organic chemical contaminants. And those are a really big deal in wastewater too. So the way I usually think about wastewater and sewage sludge is a giant soup of all of the chemicals from a community that eventually reach this treatment plant. Basically, any sort of chemicals that we use, sunscreens and soaps, they all get washed off and go down the drain. Pharmaceuticals and drugs that we take, the human body doesn't metabolize most of that, so it gets excreted into the toilet. And any type of cleaner or disinfectant, again, it gets washed down a sink or a shower. If we apply chemicals to our lawns, they go down storm drains. And here in New Haven with combined sewers, all of those places lead to the New Haven wastewater treatment plant. And so we have this big soup of chemicals that really represents a community level survey of what's out there. So there's a lot of different interesting applications of what you can do with all of this chemical data. So I'll talk about a few examples now before we get into my own data. So one of the main uses for wastewater analysis that's used by some government agencies in other parts of the world is for illicit drug monitoring. And this is something that's done by both the European Monitoring Centre for Drugs and Drug Addiction and the Australian Criminal Intelligence Commission. Both of these organizations have divisions solely devoted to wastewater monitoring to provide information about illicit drug use in various communities. So here's some example information about cocaine. So the dots on this map, the size of the dot represents the amount of cocaine use per capita in the city where the wastewater was collected. So with cocaine, we can see that a lot of cities have pretty comparable levels in Western Europe, and there's somewhat lower amounts in the wastewater further east, indicating a lower per capita use. And if you go on their website, it's really neat because they've been collecting this data for years, and you can track a single city over time, what their drug use has looked like, or you can compare cities at the same time or over time. They really have a lot of data. And they do other drugs as well. For example, here's some ecstasy data. And unlike the cocaine data, there's a lot of variability here, and you can see some partying hotspots throughout Europe, like that really big circle in the middle, that's right over Amsterdam. So it's a good way for authorities to be able to see where hotspots for different drugs are. Sometimes you can see signals in wastewater before you start to get community and individual responses from people. So it can be a very useful tool. Another thing we can use wastewater analysis for is to look at pharmaceutical concentrations in relation to public health. This graph is from a study that took place in Japan during the 2010-2011 flu season. So on this graph, that light blue line at the top, that traces the reported number of influenza cases. And then all of the lines below that, those show the concentration of Tamiflu in 5 different wastewater treatment plants. So Tamiflu is an antiviral drug that's commonly used to treat influenza. And we can see that the trend of Tamiflu very closely mirrors the number of influenza cases reported in all 5 treatment plants. So it's another way that we can use this wastewater data to reflect and investigate public health trends. We can also use wastewater to assess population level exposures to different kinds of toxins, things that might be in food unintentionally or other consumer products. The examples of these papers here are for phthalate plasticizers and for pesticides. It's a really unique kind of data to be able to look at what the inputs from a whole community add up to over time. So this wastewater-based analysis, or sometimes sludge, is really becoming an increasingly common tool to be able to tell us about the role of chemicals in public health. The project I'm working on came about because I was talking to Doug Brackney, who's another one of the scientists here at the station, and he was helping with this study on SARS-CoV-2 levels in sewage sludge, and he mentioned to me that they had extra samples, and this is amazing because it's essentially a sample library of sewage sludge collected every day starting back last March, and he wanted to know if I might be interested in analyzing some of it, knowing that I have other projects related to wastewater. So I thought this was a great opportunity and developed this project with the objectives to characterize a temporal variation of chemical contaminants in the sewage sludge during the COVID-19 outbreak and associated lockdown in New Haven, and then to relate our findings to the health and activities of local residents, as well as to broader global health trends. So again, we use the extra sample material from the virus analysis. it was more commonly people would use wastewater for this type of analysis, but sludge and wastewater are very overlapping sample matrices. So this was a really great thing for us to analyze. It came from the East Shore Water Pollution Abatement Facility in New Haven, which serves an estimated population of 200,000 who live in New Haven, Hamden, East Haven, and Woodbridge. Part of the district contains combined sewers, so that means that the plant receives stormwater that's runoff from roads and lawns and things in addition to the water that comes from households and businesses. And that's where our samples came from. This is a timeline that shows when the samples we analyzed were taken, along with some of the key dates in that first wave of the pandemic. So we did two types of sample analysis. The first was daily sample analysis. So we took the sludge samples between March 19th and April 15th, and we analyzed one sample from each day. And this covered the time period basically from the start of the pandemic and lockdown in Connecticut all the way up to the peak number of cases last April. In addition to that, we analyzed some weekly composite samples. So from these, for each week, we had 7 samples and we mixed them together and analyzed that mixture. So these weekly data points represent an average over time. And we did that for 15 weeks that span from March 19th through June 30th. So that covers that initial wave of cases and the lockdown order, as well as phase 1 reopening and the very beginning of phase 2 reopening. So it's a really interesting time period to be looking at, and I'll try to make it clear when we go through data whether we're looking at the daily samples or the weekly samples. There's advantages to both, because with daily samples you get higher resolution, but there's also a lot more noise in the data. There's more trends that affect the data other than just the chemical use, because with the combined sewers we have different rain levels. There's a lot of daily variation, and in the weekly samples those average out more. But both types of data are valuable, and I'll be showing both of them in a little while. For our sample preparation, we started by separating the solid and liquid fractions of the sludge. So we extracted the solid portion with some acetonitrile, and then we combined the acetonitrile extract with the liquid portion of the sludge in a 1-to-1 ratio and filtered it. And then our analysis was liquid chromatography coupled with tandem high resolution mass spectrometry. Data analysis was really at the heart of this project, and there was a boatload of data analysis method development that went into this work. And I'm not going to go into too much detail today, but if you're interested in our manuscript, there's a significant amount about our methods in both the main text and supplemental information. So we used 2 main data analysis softwares for our compound identification. So the first software we used was TraceFinder, and some of what we did in TraceFinder is your conventional targeted chemical screening. So that's where we have analytical standards we had about 75 compounds of analytical standards that we looked for in the sludge, and you identify the compounds by comparing the signals in the sludge samples to the signals you get when you run your standards on the instrument. So we did some of that type of analysis. And then we also did a screening analysis. And this is where we use a database that has information about compounds that we're looking for, but we don't have a standard to also run on the instrument. So here at the station, we have an internal screening database in TraceFinder that has about 1,800 different chemicals, and they include pesticides and toxins and drugs. These are things that have been used in some of our FDA work, and some things that we have collaborators that have analyzed using the same methods that we use. So it's really a database that's been built up over time. It's a very valuable resource to have. So this has exact masses of the chemicals and fragmentation masses, and we have retention times for about 800 compounds. And this is a very valuable piece of information that helps us to confirm the chemical identity. The TraceFinder methods, they all used data that we collected from the instrument in full MS and all ion fragmentation mode, which is good for screening as many things as possible, although it's not as specific and your confirmation isn't always as good as some other potential instrument collection methods. But we use these other instrument data collection methods to do a screening analysis in our other software, Compound Discoverer. So Compound Discoverer features an online database of chemicals. They have thousands of different compounds. It's called MZ Cloud. And these compounds are all different types and chemical classes. And they have these libraries of MS1 and MS2 spectra, and it will compare the spectra that you measured on your instrument to what's in the library and give you a match score. So based on this sort of automated screening and match scores, we were able to identify many additional chemicals in our samples. And again, these used a different type of instrumental analysis. This was all data collected in data-dependent MS2 mode. If any of you have more questions about the methods, I'm happy to talk about them more. So once we identified the compounds in our samples, we had additional analysis methods for determining the trends over time. So with these different chemicals we identified, for some of them that we had standards for, we had quantitative numbers for concentrations that were in the sludge extract. So with those, we could do a fully quantitative trend analysis. Other trends, all we have is the signal in our data, which is a peak. So we use peak area to look at a general trend over time. And that's good information for telling us a trend, but it doesn't tell us an absolute number for a concentration. So we have both types of data that I'm going to show today. And to determine trends, we use two different types of analysis. One of them was linear trend analysis. So we looked at the data over time and did linear regressions to see if there was an upwards or downwards trend in the samples. You can see an example of this in the graph on the left. So this shows data for avobenzone. Avobenzone is an active ingredient in many sunscreens. So you can see each point on this graph is a weekly point. We have 1 point for each week. And we have a statistically significant p-value here showing that we have an upwards trend over time. And this makes a lot of sense. People in Connecticut use a lot more sunscreen in June than they do in March. There's more sun, there's longer days. So this is a trend that we expected to see, and it was good for us that it was there. The other type of statistical analysis we did to look for trends was a multi-group comparison. So these were either ANOVAs or similar tests that we chose based on the normality and the variance in our different types of data. So for avobenzone here, this again is the weekly samples, and we clustered the data into 5-week blocks. So each box on the box plot here shows 5 weeks worth of data, and we did these multiple group statistical tests to compare the 5-week blocks. And for avobenzone, we see that statistically significant increase between our first two time blocks. So in this case, both types of analysis show an increase. And for most of the compounds we analyzed, the two different types of analysis agreed. I'll mention we have both the weekly and the daily data. We analyzed them separately from each other because we didn't always see exactly the same things in both sets. So in most cases, I'll be talking about these separately. All right, it's time to move on to some results. We found a lot of things in the sludge, so what I'm going to talk about here is mostly a collection of highlights of some of the most interesting compounds and trends that we identified. And I hope you also find them to be very interesting. Overall, we detected 78 different chemicals of interest in the sludge samples. This was using both the targeted and screening methods in both softwares. In Compound Discover in particular, we found a lot of different chemicals. And we sorted these into different categories, including ones that were specifically related to COVID-19, drugs of abuse, different kinds of medications and personal care products. And we were really happy with these results. The numbers on this slide don't necessarily add up because there were compounds that we found using more than one method. And this was a good sign, because if you use two different data analysis methods and find the same compound identification, that increases confidence in the results. So I assume most of you were watching the news at least a little bit a year ago, and probably the chemical that was mentioned the most is hydroxychloroquine. There was a lot of hope about this chemical being a successful COVID-19 treatment. Unfortunately, that didn't pan out, but it received a whole lot of publicity within a short amount of time. So the United States FDA passed an emergency use authorization for hydroxychloroquine in combination with another drug, azithromycin, that was passed during the second week of our sample collection. So you can see this graph on the left. We have our weekly data, so each data point is 1 week. And in week 3, that point with the yellow circle, we see a big increase compared to week 2. And this is when the publicity really started to be hyping up. So we see that effect. And we're not sure whether this is due to increased use in the Yale New Haven Hospital, which we assume is a significant source of pharmaceuticals to our wastewater treatment plant, or from private citizens acquiring it on their own. But I think it's really interesting to see how that spike coincides with the publicity. We also see the same trend in our daily samples. So we have this box plot on the right, and each box represents some average statistics for each 7 days of individual samples. And like in the weekly samples, week 3, those average numbers are significantly higher than week 1 and week 2. So we see the effects of this use authorization and the publicity, which I think is really cool. Not much research has previously been done on hydroxychloroquine in sludge and wastewater. It has other uses, but it's not as common a drug. So it was really neat to see this in this scenario. What wasn't publicized as much is that emergency use authorization also included azithromycin in combination with hydroxychloroquine. Azithromycin is an antibiotic, whereas hydroxychloroquine is an antiviral drug. So clearly the hope was more about hydroxychloroquine. We thought we would look at azithromycin as well. And what we found was an overall decrease over time during our 15-week sampling period. And this was another trend that we expected to see and we're happy to see, because there's been previous research about azithromycin and other antibiotics in wastewater and sludge, antibiotics that are commonly used to treat seasonal illnesses, things like sinus infections or bronchitis that tend to occur more in the colder weather. So these previous studies have found that azithromycin and other antibiotics decrease moving from winter into spring. And so that we found that trend as well, increases confidence in some of our more unique data. Disinfectants have been a big deal during the pandemic. All of the hand sanitizers and soaps and wipes and sprays. There's a lot of active ingredients in these chemicals, and their use has been increasing. There's actually literature out at this point that shows increasing disinfectant concentrations in house dust, and people who are concerned about the increased toxic effects of more disinfectant use, particularly on young children who come into contact with the floor and more surfaces more. So it's a really hot topic right now. So one of the disinfectants that we saw in the sludge was trichlocarbon. So that's this graph on the left that shows our daily sample data, so 1 point for each day. We saw a definite increase over the first 4 weeks of our study. And at first this surprised me because from what I know, trichlocarbon had been banned back in 2016. It's an endocrine disrupting compound, meaning it can have effects on hormones in both people and wildlife. And it also doesn't necessarily increase the effectiveness of hand washes and hand sanitizers. So I was surprised to still see it in sludge samples. But once I actually looked up all of those FDA orders, it turns out that it's been ruled out in phases. And actually the last ban on trichlocarbon that took it fully out of hand washes and hand sanitizers for both consumers and medical facilities, that didn't take place until the middle of 2020. So this data from March and April of 2020, it makes sense that we're still seeing it and that we're seeing it increase because hand washing and hand sanitizing definitely increased during this time. And we can see that trend reflected in the sludge. The other type of disinfectant chemical that we saw was quaternary ammonium compounds. These are commonly found in sprays and wipes used to clean surfaces. And we found upwards trends for 2 of these compounds. They're shown in the graph on the right. This analysis we had some pretty high error. We think it might be because these compounds are just pretty ubiquitous at this point. They're everywhere, but we definitely saw some increasing trends, and that pairs well with this other literature that's out there that shows that they've increased in house dust. Overall, I think we can be pretty confident that disinfectants have increased over time in both our houses and in sewage sludge, so it's neat to be able to see this data. This wasn't a class of compounds that I originally set out to analyze. This was something we found in our screening analysis, and it was a really cool result to be able to find. Benzotriazole is a chemical that you might not have heard of before. It's an anti-corrosion agent that's commonly used on cars, I think in particular brake pads, and it's also used in aircraft de-icer. This chemical we found in the sewage sludge, and we found that it followed this U-shaped trend. So this graph shows both our daily samples and our weekly samples. So we had daily samples for those first 4 weeks, and then weekly samples through the rest of our 15-week period. And what's interesting is how this U-shape correlates with the stay-at-home order and then the reopening that occurred locally. So throughout this stay-at-home order, we see a definite decrease in benzotriazole concentrations or levels, because this one's based on peak area. So we see this decrease during the stay-at-home order until it comes to a lower level and levels off a little bit. But once phase 1 reopening starts, we see it increase back up. And we hypothesized that this was due to the changes in vehicle traffic that occurred during the stay-at-home order. There's another study that's come out that shows that vehicle traffic in Connecticut as a whole decreased by 43% during the stay-at-home order. And that could certainly explain this decrease we see during the stay-at-home order. And just the experience of living in Connecticut during that lockdown, there were a lot less cars on the road. So this makes sense with the experience that I've had here. And then once phase 1 reopening started, there were more cars. So it's interesting to see sort of that lived experience reflected in the data from the sludge. There could also be a role from the other uses of benzotriazole. Aircraft de-icer is a much more needed compound in colder weather earlier in the spring, and flights at the New Haven Tweed Airport did stop during the stay-at-home order, and I think during phase 1 reopening as well. So there's a few different potential explanations, but it's a very interesting trend to be looking at. The pandemic has certainly affected mental health for many people. So one of the categories that we were really excited to look at in this study was antidepressants. So these graphs show 4 different antidepressants where we saw increases in sludge concentrations over time. So that graph on the left shows weekly sample data for 3 antidepressants. And then on the right, we have a box plot showing sertraline, which goes by the trade name Zoloft. It's a really common antidepressant. It also increased over time, and this is just in those first 4 weeks of daily sample analysis. So with sertraline, there's actually a record, if you look back in the news, there was so much increased demand for sertraline during this initial stay-at-home order that nationwide there were shortages. So we know that there was increased demand and use, and we can see evidence of that locally in the wastewater sewage sludge samples. This data also pairs well with literature that's now out about depression symptoms in the US that have increased during the pandemic. And I think, just everyone's aware, it was hard to stay home. It's still hard to stay away from people as vaccines are beginning to roll out. So it's neat to see that the experience of the pandemic reflected in chemical analysis of sludge. Sort of on a related note with mental health, we saw increases of 3 different opioid compounds in the sewage sludge samples that we looked at. This graph shows, again, our weekly composite samples, and we have increases for methadone, hydromorphone, and fentanyl. So levorfanol, another opioid, we saw a decrease, but as far as I am aware, there's much less illicit use of levorfanol. It's primarily used in hospitals for elective surgeries and other procedures that decreased during the stay-at-home order and initial pandemic. So we see this one decreasing, but the other 3 opioids on this graph, we definitely saw increases. And so it seems likely that the increases in sewage sludge are due to increased use. Now, all 3 of these compounds have illicit legal uses in hospitals, and things like fentanyl are used for people on ventilators. So it's possible that legal uses of these increased, but also very likely that illegal uses increased. There's a nationwide trend during the pandemic of increased opioid overdoses. And the pandemic has increased risk factors for drug abuse, things like isolation and economic distress. And you can see effects of that in ambulance reports and hospitalization reports. A lot of those have been published from various parts of the countries. Locally here in the wastewater treatment plant catchment area, there were 36 fatal drug overdoses during this 15-week period, and 32 of those involved opioids. Particularly fentanyl was involved in most of those. So the opioids are definitely something that's present locally, and we can see them in the sludge, and it's really unfortunate that we see this increasing trend. I want to note that the similar work that's been ongoing with wastewater monitoring in Europe and Australia, they didn't see increases in opioids like this. They actually saw some record low levels of opioid abuse in their studies. And it sort of goes to show there's a big difference with how opioids are treated over there. They don't have nearly the opioid abuse epidemic that we have here in the US. And I think it's interesting to see that reflected in the wastewater analysis. Another illicit drug that we could see in the sludge samples was cocaine, as well as several of its metabolites. In total, we saw 4 different cocaine-related compounds, including cocaine and 2 of its primary metabolites, all of which increased over time. So cocaine and benzolecgonine and another chemical that's not on the graph called ecgonine methyl ester. Those 3 provide pretty solid evidence of increasing cocaine levels in sludge over time, which is likely driven by increased amounts of cocaine use. There was another metabolite, anhydroecgonine, that decreased over time, but this metabolite is specifically an indicator of crack cocaine use. So we might be seeing a change in cocaine usage trends locally. Again, New Haven does have issues with cocaine use. During our study period, there were 17 local drug overdoses that included cocaine. So we can see this is a problem. It's something that authorities are aware of, and it's interesting to see the illicit drug problems in our town reflected in the sludge concentrations. We found a lot of other compounds in our samples as well. I'm not going to get into them in detail, but a few more that I wanted to mention. We found 3 different UV filters, which are the sunscreen active ingredients, like I discussed initially. All 3 of these increased over time. That gives us confidence in our results because I'm very sure that sunscreen use increases between March and June in Connecticut. We also saw a lot of long-term use pharmaceuticals, things that we wouldn't have expected to be affected by the pandemic, like blood pressure medications and seizure medications. And most of those did not have a trend over time. So again, we were happy to see that because we wouldn't have expected an effect of the pandemic. And this is in agreement with some other studies that have come out, including one in Europe. They didn't see many trends with these pharmaceuticals either. Also, we detected several cannabis-related compounds. We saw THC and CBD, as well as some other metabolites, but they didn't show a clear trend over time. So we don't have anything significant to say about those trends, but they were definitely there. This data is really great, and I'm really happy about it, but I want to make sure I discuss some of the limitations. One of the things about our data is that sample collection didn't begin until the beginning of the pandemic. An ideal study would have compared 2020 to 2019, but we don't have that data, so we just have to start where the samples start. Like I've said, our data is only semi-quantitative. Most of it is based on peak area analysis. So some of the really cool work that's been done in other studies where people can back calculate from wastewater or sludge into like milligrams per person per day, population usage levels, our data is not good for that. And again, most of this type of analysis is done on water and not sludge. That doesn't mean that our analysis isn't good, but it does make it a little bit difficult to compare to some other studies. Still, we think this is great data. We have a lot of method development and QA/QC that will be included in our manuscript, but this is also important to discuss. We're still working with this data. With the compound identifications, we looked at trends for 78 different chemicals, but we actually have data on over 6,000 features in our data. So we've only really looked at a small fraction of them so far. We're really interested in finding out what else is there, and if any of the chemical signatures we found correlate closely with the virus levels, to see if any of them can be used as biomarkers. And to do that, we're exploring a variety of different statistical tools and clustering analysis. This work has been slow because I have other projects ongoing and we don't have much funding for working on this, but it's really exciting to be looking at. We're hoping to have more results about this soon, and I look forward to being able to find out more. I have a lot of people I'd like to acknowledge. In particular, Elizabeth Lin is a PhD student at Yale who did a research rotation in my lab last fall. She did a lot of the analysis and statistics. Jordan Pecchia from Yale Engineering and his group, they did that initial study on the virus levels in wastewater sludge in New Haven, and they provided me access to the samples. I'd like to thank the wastewater treatment plant and funding sources and other individuals who had helped. I wouldn't have been able to do this alone. At this point, I'm happy to answer any questions. This is my contact information, so if there's anything we don't get to today, feel free to reach out by email. I also want to mention that a draft of our manuscript is available on Chem Archives. We're in the process of getting it published, but so far that's taking a while. So meanwhile, it's available there. Again, please reach out if you'd like any more information, and I'm happy to take questions. Thank you.
Okay. Well, Sarah, thanks so much for this really interesting talk. It was fascinating, and I hope this research can continue. There are some questions here, and one of the questions is, can the COVID variants be identified in sewage sludge?
So this isn't really my area of expertise, but I think possibly in some cases, yes, because what they do for the detection is they look at the RNA, and if they have the RNA fragments that are different between the virus strains, I think there's the potential to identify different variants. But again, I don't study viruses or RNA, so I'm not sure on that.
Okay, another question is, do you have any opinion on whether and to what degree the sludge microbiome interacts with the opioid metabolism in the sewage sludge? In other words, are you getting breakdown of these compounds? I suppose that's what the questioner means.
Yeah, so I'm sure there's some interaction with opioids and the sludge microbiome. I'm not sure the extent to which opioids are broken down during wastewater treatment plants with most medications. They are not fully broken down, but the bacteria in the treatment plant do have some effects. One thing that we haven't done yet with our data is look for transformation products of the compounds we identify, but that's definitely something we're interested in doing. And particularly in these samples, these are primary sludge samples, so they're collected at the very beginning of the wastewater treatment process. So the first thing that the water does when it goes into the plant is it goes into a big settling tank, and the solids sink to the bottom and they scoop out the goo at the bottom, and that's what we have to analyze. It hasn't gone through all of its different digestion steps yet. So we would expect to see minimal breakdown that occurred at the wastewater treatment plant in these particular samples. But it's an interesting area of research, like how the bacteria in wastewater treatment plant interact with the different chemicals in sludge and in water. Particularly, there's research on antibiotics, but I don't know the specific answer to your question, but I hope that helps.
Okay, here's a question from myself. You mentioned that you extracted sludge and then mixed it with the overlying water. Do you have any idea what the contribution is between the sludge component and the water component for some of these compounds? And secondly, how did you decide on using a 1-to-1 ratio of solid extracts and the water phase?
So we didn't collect any data on what's in the solid phase versus the liquid phase, but that's sort of an interesting aspect of screening studies where you don't really know what you're going to find before you start your analysis. In traditional work, you start with your compound list before you decide on your extraction method. But here, what we really wanted to do was get as broad a scope of compound as possible. So we wanted to do both the liquid and the solids, because particularly chemicals that are more hydrophobic tend to partition more to solids. So we thought that would make our work a little bit more novel to be able to look at that. And how we decided the ratio, that was somewhat based on methods we've used in the past here. Acetonitrile extraction or dilution is a strategy that we use for analyzing toxins in food that are sometimes unknown. We'll just extract the sample or mix it with acetonitrile and inject it into the instrument to see what we can find. And we were using a lot of the same instrument methods as we do for that type of analysis. So we stuck with the acetonitrile water ratio that's often common in our other types of analysis. And again, when you do a study where you don't know what you're looking for at the beginning, you just have to choose something and go with it. So we did our best with all of our standards to characterize how efficient we were at extracting different chemicals from the water and the solids, but we didn't ever analyze them separately for this study.
Okay, moving on to the next question. This person says, very interesting and dramatic results. Thank you. I was just wondering whether any compounds are present that could be reliably used to account for dilution due to rain or changes in population in this type of research.
Off the top of my head, I don't necessarily know what those compounds are, but they definitely exist. There's a lot of study on tracers in wastewater and compounds that we know are reliably and consistently present. Things like caffeine and sucralose are very common in wastewater, and the drug carbamazepine are almost always there. I don't know that they're consistent enough because they all have, daily use patterns. Caffeine, there's more like in late morning, it reaches the wastewater treatment plant. But there's definitely compounds you can use to account for that. In the studies where they analyze wastewater and then back calculate to usage levels within the population, they definitely have normalization methods. So yes, there are compounds that you can use for that. More for water than for sludge.
Okay. The next question is for compounds identified using the NTA methods, is it possible to obtain standards and reanalyze samples for quantitation?
So we actually did, after we did the compound identification step, we bought some standards for select interesting compounds. But it's hard, you would have to reanalyze all of the samples, like re-inject them into the instrument to get quantitation, because the instrument's not very consistent over time. So if we calibrate later, it's not going to be especially good data. We use the standards to confirm our identifications. We could reanalyze everything for quantification theoretically if we wanted to have another hour of instrument time per sample and set all of that up, but that's not something we've done. we definitely used additional standards to confirm some of our identification results. Those were very positive. For our compound discoverer results, all of the standards we bought matched their identified compounds. So that's definitely an important strategy.
All right, next question, or actually it's a comment. I think you have great baseline data for THC and CBD right now. If adult use marijuana is legalized in the state in the next month, tracking changes will be very interesting and useful. So I guess the questioner is wondering whether these studies are going to continue.
Yeah, that's a really good point. THC and CBD do seem like compounds that are likely to change if marijuana becomes legalized. And it would be very interesting to analyze more samples. I know that sample collection has been continuing for the purposes of the SARS-CoV-2 monitoring studies. I haven't analyzed any more samples past the ones collected in June of last year. That's definitely a potential interesting idea to be able to keep going with sample analysis. That would be really neat to look at.
Okay, and the next question is, if you have the right instrument, would you be looking for perfluorinated compounds in these types of samples?
That's something that's certainly possible, and we actually do PFAS analysis on our Orbitrap instrument that we used for this study. In this case, we didn't look for PFAS. With one factor, most PFAS on the instrument you look for in negative mode on your mass spec, and we only did positive mode analysis on these samples. We did some initial screening with negative mode and didn't see a whole lot, so we decided that we just focus on positive mode. And the other thing is that these were samples that were collected originally for virus analysis. So I don't have control over things like container type and where they were stored in lab. And with PFAS analysis, you're looking for such low levels and it's so easy to contaminate samples. So you really have to collect dedicated samples to do PFAS analysis. So PFAS are theoretically in these samples. You could analyze for them, but that wasn't part of our study because there's just so many complicating factors. Like you can't store your samples in glass. You have to use non-fluorinated plastic storage containers. Completely rinse out all of your instrument mobile phases. So theoretically you could, but there's a lot of reasons that we didn't.
Okay, that brings on the next question, actually, which is related. Are there other classes of pollutants or medications that are currently difficult to detect, but which you would like to develop methods for?
One thing that we've talked about doing is looking at more chemicals that are very hydrophilic. So that's chemicals that partition into the water phase. So they can be difficult to analyze with the type of methods that we did because they don't retain on the LC column. So our analysis is based on retention on the column and then they get analyzed by the mass spec. But if they don't get retained on the column, you tend to just lose all of that analysis. And we did have several signals at the very beginning of our LC run that might have matched to interesting compounds, but it was hard to tease out that data just because you don't have that key piece of retention time information. So we've thought about maybe using a different kind of column, like a Hillet column, to look at those different kinds of compounds. And they can include a variety of types of chemicals, things like metformin and glyphosate and a variety of other drugs that are small polar molecules. That's something we've thought about doing. To try to do different LC columns with tangential methods to look at contaminants. We're not working on that yet, though. That's something we're thinking about.
Okay, here's a question I had. You mentioned that you mentioned some studies in European cities. Are there any American cities that had been monitoring sewage sludge, sewage water in the United States that your results could be compared with?
So there's lots of groups that in the past have done wastewater monitoring studies in the US. We don't have any government bodies that I'm aware of that do this type of monitoring, but for what's been published during the pandemic, I'm only aware of one paper that's out. It's from Syracuse, New York, and they did a lot more targeted analysis. They did a little bit of non-targeted too, and they looked a lot at how the chemical levels were different in different areas of upstate New York that had different socioeconomic factors. So their data was really cool. They looked at a variety of different treatment plants, but there wasn't that much overlap between what they did and what we're doing. We're looking through our data right now to see if we see some of the same signals they did, because they looked at correlations with virus levels and think they found some compounds that correlated, and we're curious to see if those are present in our data too. But that's the only study I'm aware of right now. It's from Syracuse.
Okay. Here's a question about the opioids. It says in your slide, levorphenol use decreased while the other opioids increased. Levorphenol has an optical isomer dextrorphan, which is the primary liver metabolite of dextromethorphan, the DM in cough medicine, and it's difficult to differentiate between the two using reverse phase chromatography without ion mobility. I'm wondering if you were able to rule out dextrorphan as an alternative identification for levorphenol.
I don't think we have fully ruled that out. Levorphenol was one of our targeted analytes where we had a standard for it. So we were able to match the retention time and the mass spectra, but for an optical isomer, those things are probably going to be very close. So I don't think our method differentiated between those, but I wasn't aware that there was another compound so close. So that's an interesting thing to bring up. I'll have to look into that more. So I don't know, my colleague who has done more of the database building and worked with some of these compounds more than me might know if we have analyzed dextrorphan in the past. But at this point, I don't know. It's a good question.
Okay, I don't see any other questions on here. And unless one pops up in the next few seconds, we will virtually thank our speaker on behalf of all the others in the audience. I will applause and thank you very much for a most interesting talk.
Yes, thank you everyone for coming.